Aortic valve station. So this apparatus was modeled around the dimensions that you would normally encounter when sewing an aortic valve. You have the constraints of the box on the outside, and then you've got the constraints of your aortotomy here. This is the aorta, and then you've got your annulus here, and this is the sinuses. From this point to this point is the left coronary sinus, or a representation of that. From this point to this point, the right coronary, and then the rest would be the non-coronary. So kind of two parts to this exercise. One is just taking a needle with just a little bit of a tail, not much of a tail at all, and just practicing the types of angles that you use when you're going around the annulus on an aortic valve. And you just want to have them evenly spaced. You only need to do about 10 or 12 sutures just to ensure that you're actually doing the angles correctly. So just to review the angles, because this is the type of procedure where you do go through a lot of weird angles. So this is the regular standard 90 degrees. I'm holding it just a little bit far the back from the end, from the middle. If I want to get more control, I'll hold it right up, choke up more in the middle. Here I'm pitching it towards me. Those are going to be forehand hook shots. Here I'm pitching it away from me. And then 45-degree angle would be there. 90 degrees would be here. 45, and a little steeper there. You rarely go bigger than 90 degrees. So you rarely will ever use this type of an angle. So again, 90 degrees, 45 degrees, tilt towards me, tilt away from me. Okay, so I'm going to start slightly tilted towards me and at just a little bit off of 90, so maybe about 80 degrees. I'm going down and starting off right in the left. I will usually start right underneath the left coronary ostia. And then you pick that needle up. When you're really doing an aortic valve, you have a lot of interrupted suture. But when you're practicing at home, it would be too expensive. So I'm just traveling. These are still forehand shots. When you get assessed on this, you'll get assessed on your spacing, but mostly on your needle handling. Okay, pause.
Okay.
Again, just kind of use any tissue you have to reload. Now, here I'm going on a little bit more of a forward tilt, and I'm really bringing my needle tips closer together as I'm going around the bend. But really at this point you got to switch to a backhand. So I'm going to grab like this, and it's a backhand and a little bit of a hook. So it's got a little bit of a hook towards me, and it's a 45-degree angle. These you're almost always pulling it out with the needle driver. Except for there. So these tend to be backhand along the right coronaries. These can be very, very challenging angles actually at this spot. And your options are either to make the hook a little more dramatic, like pitching it towards me, or turning your body around and taking it as a forehand. Now I'm going to switch back to forehand, and I'm going to hook it a little towards me, just like this. Now we've got from here to here to complete. So I tend to come back down here where it was easier. And you don't want to be kind of hitting stuff, but by the same token, anything that you touch with some gentle pressure actually helps stabilize your arms. So it's all good. Here I'm hooking this towards me. These are going to be pretty severe hooks now. So these are forehand. This is almost starting to be like a fish hook. I'm turning my body a bit, which is not unusual in cardiac. And you're done. Now, the next part of this exercise is to test your symmetry a little bit more by taking those first couple of bites, which we took just along the left coronary, from the left coronary ostia to the commissure between the left coronary and the right coronary, sinuses that is. And we're just going to sew that small segments, about 4 centimeters. You're going to sew this ring to that small segment. So for this, you'll take a prolene stitch. It's it's like 18 centimeters or so you leave yourself enough room. And we go again to our forehand hooks. We start right here. Just leave a small tail. We're going to come up to the ring. Yeah, you definitely want to have the suture actually maybe even a little longer so that you can leave the ring out of your way. A couple people sew their valves with a running stitch like this. Homographs are sometimes run like this, but most often you're doing aortic valves with interrupted suturing. So this is mainly just for exercise and symmetry. And for us to have some metric to gauge how symmetric you're being. And probably lower it at this point. So remember, this is in to out, so we'll be sure to be out to in here on the ring. And since we're getting up close to that left-right divide, let's switch to the backhand. Yeah, and that's pretty much all you have to do for this one. Just you can practice continuing all the way around. It just gets a little bit awkward. And so here, when we ask you to sew the ring down to the annulus, we just want a short segment.